heat-related deaths in the U.S. have been steadily rising for years. According to a new study, more than 21,000 people die from heat-related deaths between 1999 and 2023. That's a nearly 117% spike. Most of those deaths were reported in the southwestern U.S. Using data from the CDC, researchers found the annual number of deaths varied from year to year before 2016. But since 2016, deaths have increased by nearly 17% every year. According to the World Meteorological Organization, extreme heat is the #1 weather-related killer in the U.S. And this intense heat can also be dangerous for our pets. With preparation, your pets can stay safe during the dog days of summer. Proper hydration and keeping exercise light are the most effective ways to keep your dog from overheating. Experts also recommend keep animals at home. The temperature inside a car with the windows opened even slightly can reach 102 degrees within 10 minutes. After 30 minutes, 120 degrees.
Just had a call earlier today for a dog left in a vehicle while people are in the store. Please leave your dogs at home. They may not like the air conditioning, but the heat will kill them.
The Coulee Region Humane Society also says rooms with tile floors like bathrooms and basements are great places to leave animals. They can stay cooler that way. As a summer wave of COVID-19 continues to hit the U.S., the U.S. Food and Drug Administration signed off on updated COVID-19 vaccines last week. Lee Waldman spoke with a healthcare provider about why these updates are so needed.
As the variant gets further and further advanced and more evolved, we see, of course, the bigger opportunity for it to evade immune protection.
The prevalent strain of COVID-19 in the U.S. is now KP.3.1.1, according to CDC data, and it's estimated to account for 37% of cases in the first 2 weeks of August. That's triple its level a month ago. Dr. Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, says we are in a surge.
We've seen these surges occur. There have now been 10 of them. And contrary to popular belief, they're not tied to one season.
He explains the surges are tied to new variants of COVID and waning immunity, which is why updated vaccinations are important.
Anyone here who has not had vaccines since the middle of June, have been infected since that time, should surely get another dose of this new vaccine.
The CDC recommended in June that everyone over 6 months old receive both an updated COVID-19 vaccine and a flu shot this year. Thursday, the FDA said people 5 and older are eligible to get an updated vaccine as long as it's been 2 months since their last dose.
We hope that people will avail themselves to those because they can surely do a lot to keep people from developing serious illness, hospitalizations, and deaths.
CVS and Walgreens representatives both say doses will start arriving at their locations soon, so customers can start making their appointments in the coming weeks.